So, how much of a threat does the new strain pose to hospitals? Well, we'll ask that question now to the BMA's Chair of Council, Dr. Chaand Nagpaul. Thanks very much for coming with us today. So, the Prime Minister said yesterday hospitalisations are rising in London, the South East and the East of England. What are you seeing?
Well, today we've just published the results of a major survey of doctors' experiences in the NHS over the last week, and it, in fact, paints a really bleak picture. Doctors are saying they're overwhelmed. They've seen a massive surge in COVID cases, 1 in 3 saying even more than during the first wave, but also a massive surge in non-COVID patients, so that they're actually saying they don't have the capacity, the ability to manage both, and 9 in 10 say they're not able to provide patients with the care they need. Now, last week there were 44 patients who had to be rerouted away from their local hospital to more remote sites because the hospital just didn't have the capacity to meet their urgent needs. 2 hospitals in London declared a critical incident, which occurs when a hospital feels it cannot manage acute and critical care that it's being asked to provide. So this is a serious situation, a situation that can only be helped if we can reduce the numbers of COVID patients that are occupying hospital beds. We've seen a massive increase, I think nearly about 1 in 5 extra beds occupied with COVID patients over the last week.
What I don't understand, though, is that the Nightingale hospitals that we built during the first wave are effectively still on standby. Why don't we just increase capacity if it's needed?
I think the biggest limiting factor is workforce, because we have got, unfortunately, we entered the pandemic with a shortage of doctors and nurses. I think about 80,000 vacancies in the NHS. You just can't have a doctor or nurse in 2 sites at once. So what's probably better is to try and make sure that we have as many doctors and nurses available on single sites to be able to provide care. And remember, it isn't just about COVID patients. There are large numbers of patients who do not have COVID that also need to be looked after. They can also have urgent needs, whether it's cancer, whether it's heart attacks or other acute respiratory conditions that we see in the winter. So let's not forget their needs too. And that's the problem we had in the first wave. We had, I think, around 12,000 excess deaths because patients without COVID weren't able to be seen. So it's important when we have a shortage of workforce, we make sure they can provide the most care that they can within the environment available.
We, of course, learned about this new variant of COVID at the press conference yesterday, that pretty sobering news conference that the Prime Minister said that could be 70% more transmissible. How concerned are you by these reports about the new variant?
Well, actually, we were concerned at the time that the Prime Minister announced the 5-day relaxation for Christmas, because the science told us then that the virus was spreading week on week. It just did not follow the science to relax the rules. Last Wednesday, before the new variant was announced, it was obvious that the infection was spreading at a dangerous level. The NHS was in a dangerous state. And again, the science wasn't followed when, in fact, we should have reversed the Christmas relaxation rules. So, in fact, whilst there is a new variant, we didn't need the new variant to reverse these rules. And the public could, of course, have been given greater notice. But there's no doubt it was the right and necessary decision. Now, the important point to make is that whilst it is a new variant, the way in which you control spread of the virus, including this new variant, is exactly the same. It's about continuing stringent measures to maintain physical distancing of 2 meters or more, stringent use of masks, and also hand washing. The same rules apply. And I think one of the problems we've seen over the last few weeks is that those rules have not been adhered to in a stringent way. I think that will require the government in the future to take more action to make sure we don't see scenes of crowded streets in London with shoppers, because that is the sort of way in which this virus is spreading.
You're talking there about compliance, about people following the rules, about the scenes of crowded shopping streets. We, of course, saw those scenes of people piling onto the trains, didn't we, to try and leave London when the new restrictions came in. What would you say to people who are thinking about breaking the rules over the festive period? And you said that more action from the government is needed. What do you mean by that?
What I mean is just making sure there's crowd control and measures like that. I mean, I would just ask the question, you wouldn't see those scenes in East Asian countries that have managed pandemics well in the past. That's what I'm talking about, just making sure that we have clear arrangements so that people can be separated. But I think it's more than rules. What I think is really important for the public to understand is this is an unforgiving virus. And in fact, whilst Christmas is obviously going to be ruined for many, the worst thing we could possibly be doing is unknowingly infected our loved ones, infecting people who are older in our families, who have underlying conditions, only to find that 2 weeks later in the new year, they end up with serious illness in hospital fighting for their lives. Now, that's not being alarmist. That's unfortunately the way this virus behaves. And the worst thing about this virus is that 1 in 3 people may not even know they're carrying the virus. So you may actually be passing it on unknowingly. So I think what the important message for the public is, please understand this is a serious risk. And when we talk about the NHS and we say, let's reduce pressure on the NHS, please let's also remember that the NHS isn't some remote, disconnected service. It's a service that any of us may need to use if there's an urgent need. And none of us want to be in a position where the health service cannot be there for you when you need, because it's full, it's at full capacity, and is then forcing you to be transported to some more remote site with all the delays that's involved. So please let's understand that saving and protecting each other and looking after each other is also as important, or really will result in protecting our National Health Service.
It's been a pretty depressing weekend for all of us. Listening to you is extremely sort of sobering as well. So let's talk about the light that there is at the end of the tunnel, which of course is the vaccine. Doctors, GPs expected to play a really key role in getting that vaccine out. How quickly do you think it can be rolled out to the population?
Well, we are working flat out. I'm a GP, and my practice was one of the first in the pilots to start on Tuesday. We serve a very large Black and Asian ethnic minority population that have been hit really hard by this virus, and many did not survive during the last year. And so it was really, I have to say, it was positive. It was very heartening to see so many patients come along and be vaccinated. And of course, these were patients who were much older, who were most at risk. And we've been working 7 days a week, 8 a.m. to 8 p.m. And in fact, many doctors staying there right and through till about 10 o'clock at night. So we are working flat out. It will take, unfortunately, 3 to 4 months for enough of the population to be vaccinated. That's what the projections suggest. But and therefore there is light at the end of the tunnel. And so I hope people, the public, can understand and be patient. Just carry on being responsible, follow the rules and measures, because you will be, if all goes well, in a few months, be able to mix with family, friends and relatives. So the vaccination program is critical, but I'm actually very proud of the way in which healthcare workers are delivering this program. GP practices in the community, many hospital sites, but I think we also have to be recognise that to deliver this in this sort of short space of time will mean huge amounts of staff time, and for some of those staff, they won't be able to be carrying on with their normal roles. But yes, there is light at the end of the tunnel at the moment with the vaccine.
It does feel like that's the one difference, the one chink of light compared to the last wave, the first wave, that at least we can see an exit route now. Dr. Chaand, Nagpaul, thank you very much for being on the programme. As always, good to talk to you.
Thank you.